Okay, so Ryan has a shoulder problem. We're going to try to figure out what it is. So the first thing, can I get you to actually come and stand back here for me? Actually, you can sit. It's fine if you sit. So what I want you to do first, I'm going to have you hold your arm up like here and just relax your arm for me. What I'm going to do is I'm going to turn your arm inwards, and I want you to let me know if there's any pain. Pain with that at all?
No.
Okay. I feel a tissue stretch, but there's no like muscle spasm around it. And if I externally rotate your arm, is this the arm that had the problem?
Yeah.
If I externally rotate, do you have any pain with that?
No.
Okay, so it's negative for, I also felt tissue stretch with that one on the right arm. So it's negative for an AC joint pathology or labral tear. I'm going to do the same, or a slap lesion. I'm going to do the same thing on this side just to test bilaterally. So I'm going to bring this and just relax your arm for me. Just going to turn it into internal rotation. So I'm at about 15 degrees horizontal adduction and 90 degrees of flexion. Pain with that one?
No.
If I externally rotate. I feel a tissue stretch with the first one. Do you have any pain with that?
No.
So I feel a tissue stretch with external rotation as well. No pain in your AC joint or no pain deep in the
No.
shoulder socket? Okay. So it's negative for slap lesion, all that stuff, AC joint pathology. I'm going to also test glenohumeral mobility. So what I'm going to do is I'm going to do a load and shift test. I'm going to test the uninjured shoulder first. So what I'm going to do is I'm going to find the humeral head and the greater tuberosity. I'm going to push it up and in, placing an axial load on the glenohumeral socket joint, and I'm just going to rotate, pull anteriorly, and I'm going to push posteriorly. Is there any pain with either of those?
No.
Okay. There's a little more mobility anteriorly compared to posteriorly, and I kind of get a capsular angle with the posterior shift. But overall, it's normal. I'm going to do the same thing on this side. So I'm going to come in, find the biceps tendon, trace it all the way to the greater tuberosity, find the humeral head. I'm going to push that into the glenohumeral joint. I'm just going to push posteriorly. Pain with that one at all?
No.
If I pull anteriorly, pain with that?
No.
Okay, so there's a little more posterior movement with this one, but compared to the left arm, left shoulder, but I had about the same amount of anterior movement. Once again, I didn't feel any muscle spasm or joint restriction at all going through that. So this joint seems quite stable. The last test I'm going to do is Hawkins-Kennedy test. So what I'm going to have you do is put your arm up in front of you like this, and I'm just going to push down your arm into internal rotation, and I just want you to let me know if you get any pain at all. Pain with that at all?
No.
Nothing back here in your shoulder at all?
No.
Okay. I'm going to do the same thing on the other side, so bring your arm up. Go a little bit more. And then I'm just going to push down internally rotating your arm.
Yeah, that kind of hurts.
And where does it hurt?
Just like right here.
Okay. So I felt a little more muscle spasm before I even got to the end feel with that one. Of pain, and what would you say the pain is on a scale of 0 to 10?
Like a 6.
Okay. So pain indicates it could be positive sign for impingement, potentially the biceps tendon in the front.